Not always. Other things can make it elevated, but we have to check. We can do other tests to determine whether or not it's due to an infection or something like that.
2 questions, and take your time to answer this. The first question is, how often should a person go in to be checked? Should a male go in to be checked?
Once a year.
Once a year. At any particular age? What
Starting
age?
at age 40 for African Americans and for 45 to 50 for non-African Americans.
Okay, the next question. Now you said, can this be misdiagnosed for something else? Can prostate cancer be misdiagnosed outside of taking the test?
Well,
is this only specific for
the PSA?
For prostate? Yes.
The PSA, only the prostate makes PSA. So if the PSA is elevated, it's got to be a prostate problem. And then we can do other kinds of tests to determine whether or not it is prostate cancer or it's something else. Okay. But the PSA and the rectal examination, as you can see, this is the rectum right here. And you can feel the prostate is not in the rectum, but you feel the prostate through the rectum. It's a 5-second examination. 5-second examination. That's all the time it takes. And what you're doing is, the normal prostate feels very much like this part of your hand. So when we're putting the finger in the rectum, feeling the prostate, we're trying to feel something that feels like this. If we feel something that feels like this, like the knuckle, that's hard. That's exactly what the cancer feels like. So if we feel something that feels like a knuckle, no matter what the PSA is, we are going to then do a biopsy, which means we're going to take a very small piece of the tissue out of this area where we feel the bump and look at it under the microscope to examine it for cancer cells.
Okay, hold that thought. We'll be right back after this. Don't go away.
Where did all the blue skies go? Poison is the wind that blows from the north and south and east. Whoa, mercy, mercy me. All things ain't what they used to be. No.
Welcome back. I'm Tia Mugabe, and this is Here We Are. We're talking to Dr. Terry Mason about prostate cancer, and I want to kind of make sure I get to all my questions. But once detected, once the prostate cancer detected, depending on the stage that it's in, especially when you're dealing with surgery, what is that procedure? Can it be is it an inpatient surgery? Can it be an outpatient procedure? I know that with all the advances in that field, a lot of times you can have outpatient surgery on stuff like that.
Well, if we're talking about a surgical procedure to take the entire prostate out of the body, then that is usually an inpatient procedure. In other words, the patient comes in the morning of surgery, has the prostate removed, and then is admitted, and usually in the hospital for about 2 to 3 days.
Okay, okay. Now, does a surgery like this, we're talking about the worst case scenario, you have the prostate removed, does it affect the sex drive? Because that's one major issue with a lot of men, you know, that will this affect my sex drive?
Well, let me answer this question this way. It won't affect his drive, but it'll affect his ability. He'll want to, but he won't be able to. And let me explain what I mean by that.
Okay.
Now, if we can get the cancer early enough, we can do the operation in such a way where we can protect or try to protect the nerves that are responsible for erection. Okay? And if we can do that successfully, then the patient will have a much higher likelihood of being able to keep his ability to have an erection. If the cancer is somewhat later and we are not able to save those nerves that run right alongside the prostate, then the likelihood that he is going to be rendered impotent or unable to have intercourse is going to be relatively high. And that's why we're looking at other other things that we can do. For example, like freezing the prostate and radiating the prostate, which is carries a much less incidence. But I'll tell you something that's more important. You can think, we think that the sex is the whole deal, but I'm going to tell you, most men, most people urinate more often than they have sex. And One of the problems with the operation is that you can have damage to the muscle where you don't have control over your ability to urinate. Now, granted, that only happens in a small number of cases, but it is a potential complication. And when it does, if it's bad, you could lose the ability to control the urine, which is mean you'd be wearing a diaper or be wet all the time. So that, to me, is actually worse because it's a real social problem. Now fortunately, that doesn't happen in at least 95% of the cases. So in 95 to 90% of the cases, you are able to maintain your ability to control your urine.
Okay.
Okay.
In light of that, what you just said, do you have patients after saying, okay, this is what you have, these are the complications that are connected with it, or these are the side effects that could possibly happen to be affected by that you can be affected with. Do you have some patients just elect not to have the surgery?
Yes.
For what reasons?
Well, some men don't want to have the surgery because, and there's some men that don't need to have the surgery. For example, I won't operate on a man over 73 years old because I know that he's probably going to do just as well with some of the other therapies. We usually reserve the operation for younger men who have a longer life expectancy. Okay? A man 80 years old that gets prostate cancer, we probably don't have to do anything at all because that man is not going to die from his prostate cancer. He's going to die from a heart attack or a stroke or something like that. But a man 60 years old or 65 years old statistically should live long enough that we need to do something. And usually we think, although we don't know absolutely for sure, but we think that surgery will give him a slightly better chance for longer term survival. But we're learning better now which patients we should select to have surgery versus some of the other therapies, and whether or not we need to add other kinds of drugs or what have you to give them the best possible chance for cure.
What are where are some of the places, and we're here in Chicago, are some of the best places to go with people who specialize in this type of...
Well, all your major university centers, I think, are always good places. The University of Chicago, the University of Illinois, the Northwestern, Loyola University, and I rather think I do a pretty good job too at Mercy Hospital. We're affiliated with the University of Illinois, and I've been doing this. And there's if I can, there's an excellent article that really lays out a lot of this that's published in this month's Ebony, the April Ebony magazine, that really talks about. And we have a lot of black men, prominent black men and men that are not necessarily in the spotlight that have been stricken with this disease. But more importantly, we have a lot of men who are survivors of this disease. And if we stop acting like nothing is ever wrong with us and start treating ourselves a little better than we treat our cars and come in early and find out about these things, we can increase our length of survivorship and have the same quality of life that we would have had we never had prostate cancer.
So the bottom line is, the earlier you get in, the more frequent you go to get your regular checkups, the easier it is for this, or the better your chances for this being detected.
You wouldn't wait.
Better chance for this being a problem.
You wouldn't wait for your car to throw a rod before you decide to go in and get the oil change. You wouldn't wait for blue smoke to start coming out the tailpipe before you take your car in to get it checked. So why would you wait till you get back pain and blood in the urine and all those sorts of horrible things happen to you before you decide to come in and do something about that? We also have to change our lifestyle.
Okay, and that was the other thing I wanted to get back to. Let's talk about the diet again. You were talking about tomatoes. What about things like hot sauce and salsa, ketchup, that have that tomato base to it?
Well, most tomato-based products, but the more tomato and less the other stuff, the better it is.
Okay, because my father's a big hot sauce fanatic.
Okay, now hot sauce it has some tomato stuff in it, but that's not the source of lycopene you want.
Okay.
You want a tomato sauce like you get with spaghetti or like what they put on pizza. But I'm not advocating people run out and start eating a bunch of pizza. Eat what you need. Eat the tomato sauce or eat the tomatoes. And we need to go back to, see, we don't exercise enough. One of the major problems in the African American community is obesity. We got bigger kids, bigger young adults than we ever had. We don't exercise enough. And there are studies now that prove that exercise, moderate exercise, 20 minutes a day for at least 3 days a week, and cutting down the fat in your diet, cutting out the cigarette smoking, decreasing the alcohol will decrease the risk of cancer 30%.